Hello everyone, I am Dr. Palak Shroff Bhatti, Head Neck and ENT Surgeon practicing in Mumbai. I would like to speak about neck incisions.
So I hereby share with you the slideshow demonstrating various incisions for neck surgeries. As we all know, surgical incisions are used in neck dissections, thyroid, laryngeal surgeries, neck node biopsies, branchial cyst excisions, abscesses, etc. So depending on the site, they can be involving the midline of the neck, the lateral portion of the neck. The important points are that no specific incision or a combination of incision has received universal acceptance. It all depends upon the adequate exposure for the optimum disease clearance, maintaining the flap vascularity, accessibility to the site, duration to raise the flap, possibility of damage to vital structures, post-op wound healing and scar cosmesis. Now, flap vascularity is critical for healing and successful outcomes of a surgery. Surgeons must assess the blood supply prior to flap elevation, and in that, they can use techniques like perforator mapping. In the neck, the perforators are present in between the skin and the platysma. Hence, platysma should be included in the flaps. So here I would like to highlight the watershed area in the neck. Now the watershed area is that area which receives the supply from the external carotid in the neck and subclavian branches. So there is an anastomosis here, and this area is called the watershed area. Now thyroid surgery incisions involve a horizontal skin crease incision, two finger spaces above the suprasternal notch, and the length depends upon the size of the tumor. In laryngeal surgeries, the Gluck-Sorensen's incision is taken, wherein two hockey stick incisions on either side, which are joined by the horizontal skin crease incision. The Kreis incision is commonly used. Horizontal limb of this incision starts from the mastoid tip, goes two finger spaces below the ramus of the mandible, and then curves up to the submental area. The vertical limb starts just behind the pulsations of the carotid, going backwards in the form of a slanting L, meeting the clavicle at the midpoint. McAfee involves two horizontal incisions. The superior one is the same as used in Kreil, whereas the lower one is two finger spaces or 1 inch above the clavicle. This type of incision is mainly used in post-radiation necks where there is a possibility of flap necrosis if we include the vertical limb. However, this takes longest time to raise the flap and it takes shortest time to close. It is not suitable for short necks. Modified McAfee, there is a little deeper curve than the above the McAfee one, wherein it goes up to the lower level of the cricoid cartilage. This gives a better clearance of level 3 lymph nodes. In a modification of this, there is something called as a Martin's incision. Now, Martin's incision normally is the gap which is bridging these two incisions. Schobinger's incision or the reverse hockey stick incision is a single incision starting from submental area midpoint, going down up to 2 finger spaces below the ramus of the mandible, and then gently curving down up to the midpoint of the clavicle in the form of a gentle S. This takes a shorter time to raise the flap. And modified Schobinger's incision includes a posterior extension going up to the mastoid tip. Now this takes a longer time for closure, however shorter time for elevation.
As the proverb goes, well begun is half done. Incisions are the first step in a surgery, and one must take time out to plan it prior to the surgery for optimum outcome. Thank you.